Today, we are breaking the silence on a health condition that millions of people suffer from in complete secrecy, but almost nobody wants to talk about it out loud. We are talking about hemorrhoids, or what many of us commonly know as piles. Let's be completely honest with each other. It is painful, it is highly uncomfortable, and for so many people, it carries an overwhelming sense of embarrassment. But you do not have to suffer in silence anymore. Joining us on set today is Dr. Thomas Sanu, a leading medical expert who's going to walk us through everything. What causes it, how to know if you have it, what your treatment options are, and how to actually deal with it without the embarrassment. Doctor, thank you so much for being here with us today.
Thank you so much for having me. I am really glad we are having this conversation because this is one of those conditions where silence is genuinely making people worse.
Doctor, let's start with the sheer scale of this problem. So many people feel completely isolated when they develop piles. How common is this condition truly? And psychologically, why do you think there is such a heavy social stigma attached to it?
You'd be shocked how common it is. Up to 75% of people will experience hemorrhoids in their lifetime. So if you're watching and think you're alone in this, you're not. The problem is nobody talks about it because it affects a private part of the body. Hemorrhoids are not about hygiene or character. They can affect anyone, young, old, men, women.
Exactly. It's incredibly common. But let's talk about the scare factor, because this is where the anxiety peaks. A lot of our viewers write to us saying they experience sudden bleeding during a bowel movement and their mind instantly jumped to the absolute worst case scenario. What are the early signs people often ignore or mistake for something else?
Bleeding is what usually causes panic, and I understand that. But hemorrhoid bleeding is typically bright red. You'll see it on tissue or in the toilet bowl. That brightness tells us it's coming from low in the digestive tract, not somewhere more serious. That said, never ignore bleeding. Always get it checked. Early signs people often dismiss include itching around the rectal area, a sense of pressure or discomfort, mild swelling they cannot explain, and sometimes a mucus discharge after passing stool. These are your body's early warnings. Ignoring them for weeks or months is when things get harder to manage.
Now, let's talk about lifestyle, because our daily habits have changed drastically. We live in a world where we sit at office desks for 8 hours a day, we then sit in traffic for hours, and we carry a lot of stress in our bodies. And let's also face it, many of us scroll through our smartphones on the toilet for way too long. What are the primary root causes of piles?
Prolonged sitting on the toilet is one of the more underrated contributors. But let's go broader. The primary causes come down to a few key things: chronic constipation and repeated straining, a low-fiber diet, a sedentary lifestyle with poor circulation, pregnancy, chronic diarrhea, and then there's age. As we get older, the supporting tissue around those veins naturally weakens. So it is rarely one single cause. It's usually a combination of lifestyle factors that accumulate over time.
So when someone finally realizes, okay, I have piles, the immediate reaction is usually a frantic late-night Google search. People run to the pharmacy for random over-the-counter creams, or they try sitz baths. Doctor, let's talk solutions, because I know this is what everyone's been waiting for. What treatment options are available today, from mild to more advanced cases?
Great question. For mild to moderate cases, it starts with lifestyle changes. More fiber, more water, better bowel habits. For over-the-counter options, I point my patients specifically to the NAFDAC-approved Hemocare combo, because unlike standard medications that only mask symptoms, Hemocare works from the inside out. It addresses the root cause while relieving the pain and swelling you can feel. A far more complete solution. For extreme cases, surgery. But the majority of people never need to reach that point if they act early and use the right treatment from the start.
A lot of people do not want to resort to surgery because it's expensive and can be painful. Some of our viewers have said it comes back even after going under the knife. What makes the Hemocare combo so unique in its approach to piles?
Those viewers are right. Surgery alone can lead to recurrence because the root cause isn't addressed. What makes the Hemocare combo different is its two-pronged approach. The balm tackles external symptoms, the pain, swelling, and irritation you can feel. The capsule works internally, targeting inflamed veins, strengthening blood vessel walls, and treating the root cause. Most medications only cool down the fire. Hemocare removes what's fueling it, which is why we see more complete resolution of symptoms rather than just temporary masking.
From a medical standpoint, why is this inside-out approach so much more effective than just slapping a basic standard cream on the problem?
Think of it like a rusted pipe. You can put tape over the crack. That's what a standard cream does. But Hemocare fixes the pipe itself. The capsules improve blood flow, reduce venous pressure, and strengthen the blood vessels. The balm soothes the external area. That's what makes it superior to other medications.
And who exactly can use this? Is it safe for anyone dealing with hemorrhoids, or are there exceptions?
As for who can use it, it's suitable for adults with both internal and external hemorrhoids, men and women, from the age of 9 and above. Pregnant or breastfeeding women should consult their doctor first as a precaution. It's a safe, effective, non-invasive option for everyone.
That's good to know. How long does recovery typically take with a product like that? And can people go about their normal lives while using it?
That is one of the things I appreciate most about the Hemocare combo. It does not disrupt your life. You can continue with your normal daily routine. Most people begin to notice a difference, which is reduced discomfort, less swelling, and more ease with bowel movements within the first 1 to 2 weeks of consistent use. For more significant or long-standing cases, a full course of 4 to 6 weeks typically delivers the most complete results. The key word there is consistent. You have to use it as directed and pair it with the lifestyle changes we discussed. More fiber, more water, less prolonged sitting. When people do that, the results are genuinely impressive and they tend to last.
Before we wrap up, Doctor, what daily habits can help people prevent this from developing or coming back?
Prevention comes down to a few things. Eat more fiber, drink enough water daily, move your body. Even a 20-minute walk helps circulation. Respond when your body signals the urge to go. Don't sit on the toilet too long. And manage your stress. It affects your gut more than people realize.
If there's one thing you wish more people understood about this condition before it becomes a bigger problem, what would it be?
My one message to everyone watching: hemorrhoids are very treatable, but only when you act early. I've seen patients suffer for years unnecessarily. Don't wait. If you recognize the symptoms, get the NAFDAC-approved Hemocare combo and tackle it fast.
Doctor, thank you so much for breaking this down for us today, and more importantly, for helping take some of the shame out of this conversation. If you or a loved one is dealing with the misery of piles, do not wait for it to get worse. The Hemocare combo is available right now. We have a special offer running exclusively for you today, and you can grab it in 10 minutes after watching this segment. Don't miss it.